Introduction to limbs. In this short lecture, we will be introducing you to the upper limb and the lower limb. During the lecture, we will touch upon on these main topics: the skeleton of the two limbs, the muscle compartments, where we will be discussing the attachment and action of muscle groups in each of these limbs and their innervation. Innervation means the nerve supply. We will be discussing the brachial plexus in relation to the upper limb and the lumbar plexus in relation to the lower limb. We will be also introducing you to the special regions. In the upper limb, we will be discussing about the axilla and the carpal tunnel. In the lower limb, about the femoral triangle and the gluteal region. At the end, we will be discussing about the joints and the ligaments in these two limbs. All the discussions that we will be doing during this lecture are just an introduction, and details of these structures and regions will be discussed further in another series of lectures. When it comes to the skeleton of the upper limb and the lower limb, there are several similarities. Both upper limb and lower limb has several parts. Upper limb has an arm, forearm, and a hand. Lower limb has a thigh, leg, and a foot. Upper limb is attached to the axial skeleton, which is formed by the skull, vertebral column, and the rib cage here, with the sternum in front, through the shoulder girdle. Similarly, the lower limb is attached to the axial skeleton through the hip girdle or the pelvic girdle. In the arm of the upper limb, there is one bone, which is called the humerus. In the forearm, there are two bones. In the anatomical position, the laterally placed bone is called the radius, and the medially placed bone is called the ulna. Then, in the hand, proximally, there are 8 carpal bones, 4 of them in a proximal row and another 4 in the distal row. Then distal to the carpal bones, there are metacarpal bones, and further distally, there are phalanges. In the thumb, there are 2 phalanges, and in other fingers, there are 3 phalanges each. When it comes to the lower limb, there is one bone in the thigh, which is called the femur. In the leg, again there are 2 bones. The medially placed bone is called the tibia, and the laterally placed bone is called fibula. There are 7 tarsal bones proximally in the foot, and there are 5 metatarsal bones, and there are phalanges attached to the metatarsal bones. There are 2 phalanges when it comes to the big toe, and there are 3 phalanges each when it comes to the other toes. We will first take a look at the upper limb. As I mentioned before, the upper limb has several bones. The humerus forming the arm, radius and ulna forming the forearm, carpal bones, metacarpal bones, and the phalanges forming the hand. The upper limb is attached to the axial skeleton, which is formed by the skull, vertebral column, ribs and the sternum through the pectoral girdle, or you call it shoulder girdle. Shoulder girdle consists of 2 bones, the clavicle and the scapula. These 2 bones are attached to the axial skeleton through one joint, which is called the sternoclavicular joint, which is located here. There is another joint between the 2 bones, the clavicle and the scapula, which is called the acromioclavicular joint, and which is here. Except the sternoclavicular joint, which I mentioned already, in all other places, the pectoral girdle is attached to the axial skeleton through bones or ligaments. When you study muscle attachments in detail, you will see that certain muscles are attached between the axial skeleton and the clavicle, and certain other muscles are attached between the axial skeleton and the scapula, and some other muscles are attached between the axial skeleton and the proximal end of the humerus. Now we will take a look at the muscles that attach the pectoral girdle and the upper limb to the axial skeleton. Sternocleidomastoid is a muscle that attaches the medial end of the clavicle to the skull, which is this one. And the subclavius is a muscle that attaches the clavicle to the first rib here. Trapezius, which is this one, is a large muscle which attaches the clavicle and the scapula to the vertebral column. I have shown only part of that muscle here. These muscles are short muscles that attach the vertebral border, which is this border of the scapula, to the axial skeleton, the vertebral column. This is levator scapulae, this is rhomboid minor and rhomboid major muscles. This is called serratus anterior muscle, which is also attached to the vertebral border of the scapula, but it is located on the anterior aspect. Therefore, you cannot see it unless you remove the scapula from here. It's on the anterior side, that's why I have shown it with dotted lines here. This is pectoralis minor muscle, which is attached between the rib cage and the coracoid process of the scapula. When you study the parts of these bones, you will see these small parts. Then there are two other muscles which are called pectoralis major muscle and the latissimus dorsi muscle. They are not directly attached to the pectoral girdle, but they are attached to the proximal end of the humerus. All these muscles, whether they are directly attached to the clavicle or scapula, or whether they are attached to the proximal end of the humerus, like pectoralis major and latissimus dorsi, they can move the upper limb and the pectoral girdle. Now we will learn the muscles that are attached between the pectoral girdle and the humerus. Since these muscles are attached between the pectoral girdle and the humerus, they can move the shoulder joint. This muscle is the biceps brachii muscle, which is attached to the supraglenoid tubercle of the scapula here, which you will learn when you study the bones. And there is another head of that muscle which is attached to the coracoid process here, which is called the short head of biceps. This one is called the long head of biceps, which is attached to the supraglenoid tubercle, and this one is called the short head, which is attached to the coracoid process of the scapula. Then there is another muscle called trapezius muscle, which is attached to the infraglenoid tubercle of the scapula here. The biceps muscle, which I was talking about here, flexes the shoulder joint, and the triceps muscle, which is shown here, extends the shoulder joint. These two muscles are called teres minor and teres major muscles. They are also attached to the proximal end of the humerus here. This is called infraspinatus muscle because it lies below the spine of the scapula. And this is called supraspinatus because it lies above the spine of the scapula. And there is another important muscle which is anterior to the scapula. That's why I have drawn it with these dotted lines. It is on the anterior side, covered by the scapula behind, and that is also attached to the proximal end of the humerus on the anterior aspect. Covering all these muscles is a fairly large muscle which is called the deltoid muscle, which is attached to the clavicle, scapula, and the shaft of the humerus here. There are two muscles attached to the anterior aspect of the chest wall that can move the upper limb. One of these muscles is called the pectoralis major muscle. If you remove the pectoralis major muscle, then you can see the pectoralis minor muscle, which is a fairly small muscle. Pectoralis major muscle, as you can see, is attached to the lateral border of the sternum here, the medial side of the clavicle, and the ribs in that area. Pectoralis minor muscle is attached to the middle ribs here, and at the distal end it is attached to the coracoid process of the scapula. Four short muscles attached around the shoulder joint, which are having short flat tendons, are called rotator cuff muscles. There are four rotator cuff muscles. You have already seen these muscles. I will name them for you. Supraspinatus, infraspinatus, subscapularis. Now this is the anterior view and this is the posterior view. Remember that. And teres minor muscle. So it is supraspinatus, infraspinatus, subscapularis, and teres minor muscle. So altogether it's four muscles. These four muscles are called rotator cuff muscles, and these muscles are important to maintain the shoulder joint in position. Now we will take a look at the compartments of the right arm. There are two compartments in the right arm, the anterior compartment and the posterior compartment. The deep fascia of the arm separates the arm into an anterior compartment and a posterior compartment by sending a medial intermuscular septum and a lateral intermuscular septum to get attached to the periosteum of the humerus. In other words, the medial intermuscular septum and the lateral intermuscular septum, which is attached to the periosteum of the bone and the deep fascia of the arm, separates the arm into two compartments. There are three muscles in the anterior compartment: coracobrachialis, biceps brachii, and brachialis. You will study the details of these three muscles later. The muscle of the compartment, the nerve of the compartment, is the musculocutaneous nerve. The posterior compartment contains one muscle, which is the triceps muscle. The nerve that supplies the triceps muscle is the radial nerve. In this cross section, which was taken at the mid arm, you can see two of the three muscles that form the anterior compartment: biceps brachii and the brachialis, lying deep to the biceps brachii. Coracobrachialis is not seen in this section because it ends proximal to this level. The nerve of the anterior compartment, which is called the musculocutaneous nerve, is seen to lie between the two muscles here. In the posterior compartment, you can see the large triceps muscle with its three heads: medial head, lateral head, and the long head. The nerve of the posterior compartment, which is the radial nerve, this one, is seen to related to the posterior surface of the humerus. The area of the humerus to which it is related is called the radial groove. You can see some of these muscles in this diagram as well. Long head and short head of biceps muscle, coracobrachialis muscle, and the brachialis muscle. The biceps brachii muscle is inserted into the radius of the forearm distally. Area where it is inserted is called the radial tuberosity. Radial tuberosity is this area of the radius. On the posterior side, in the posterior compartment, the large triceps muscle can be seen with its long head, lateral head, and the medial head. Like the arm, forearm also has anterior and posterior compartments. But in the forearm, both anterior and posterior compartments are further divided into a superficial and a deep compartment. If you look at this diagram, you can identify some of the muscles that form the anterior compartment. The superficial group includes the pronator teres muscle, flexor carpi radialis muscle, palmaris longus muscle, and the flexor carpi ulnaris muscle. Then just deep to these four muscles, there is a fifth muscle in the superficial compartment, which is called the flexor digitorum superficialis muscle. All these parts are belonging to the superficial flexor digitorum superficialis muscle. All these muscles, all these five muscles that I mentioned, take origin from the medial epicondyle of the humerus. Then, deep to these five muscles are the three muscles of the deep compartment. The three muscles are the flexor pollicis longus muscle, flexor digitorum profundus muscle, and the pronator quadratus muscle. Pronator quadratus muscle lies at a slightly deeper plane than the other two muscles. Some of these muscles are attached to the carpal bones here, and they are responsible for the flexion, abduction, and adduction of the wrist joint. And some other tendons, which are long tendons, pass into the hand and fingers and get attached to the phalanges of the fingers. Pronator quadratus, on the other hand, does not enter the hand. It is attached to the radius and ulna distally. In this diagram, the person who drew this diagram has tried to show the long tendons of flexor muscles. As you can see here, the long tendons of flexor muscles pass through a fibro-osseous tunnel called carpal tunnel at the wrist, formed by the carpal bones behind and the flexor retinaculum in front. You can identify the flexor pollicis longus tendon here and the long tendons of the flexor digitorum, profundus and superficialis, shown in red color here. Short muscles of the hand with their origin and insertion both within the hand are called intrinsic muscles of the hand. They form a group in relation to the thumb, which is called the thenar muscles, and they form another group in relation to the little finger, which is called the hypothenar group of muscles. In between, there are other muscles which take origin from the long flexor tendons, which are called lumbricals. There are 4 lumbricals taking origin from 4 long flexor tendons of flexor digitorum profundus. Then there is another group of muscles which are called interosseous muscles. The plural term is interossei. There are palmar interossei and dorsal interossei. Details of these muscles will be learned later. Now we will take a look at the extensor muscles of the forearm. As I said before, they are also arranged in 2 groups, the superficial group and the deep group. The superficial group includes brachioradialis muscle, extensor carpi radialis longus muscle and the brevis muscle, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and the anconeus muscles. The deep group includes a muscle here which is called supinator muscle, abductor pollicis longus muscle, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. The tendons of long extensor muscles expand at the back of the fingers and they form what is called extensor hood or extensor expansion. The interosseous muscles that I mentioned before and the lumbricals are attached to this extensor expansion. The extensors extend the interphalangeal joints, while the long flexors that we mentioned before flexes the interphalangeal joints. Brachial plexus is a network of nerves that supply the muscles of the upper limb. It is formed by C5, C6, C7, C8 and T1 spinal nerves. These are called anterior primary rami of spinal nerves. The upper 2 roots, C5 and C6, unite and form what is called upper trunk of brachial plexus. Then C8 and T1, the lower 2 roots, combine and form what is called lower trunk. The anterior primary ramus of C7 spinal nerve continues as the middle trunk. Each of these trunks, superior, middle and inferior trunks, divide into an anterior division and a posterior division. Anterior division, posterior division. All posterior divisions, as you can see here in green, unite and form what is called posterior cord of brachial plexus. The anterior division of upper trunk and the middle trunk combine and form lateral cord of brachial plexus, and the anterior division of the lower trunk continues as the medial cord of brachial plexus. These cords are named based on their relationship to the axillary artery. The cord that is lateral to the axillary artery is called lateral cord. The cord that is medial to the axillary artery is called medial cord, and the cord that lies behind the axillary artery is called the posterior cord. Cords of brachial plexus gives branches, which are the nerves that supply the muscles of the upper limb. Lateral cord gives 3 branches. Posterior cord gives 5 branches, and the medial cord gives another 5 branches. This is the musculocutaneous nerve. It is a branch from the lateral cord of brachial plexus. You have already learned that this is the nerve of the anterior compartment of the arm. This is the axillary nerve, and this is the radial nerve. They are branches from the posterior cord of brachial plexus. Axillary nerve is an important nerve because it supplies the deltoid muscle. Radial nerve supplies the triceps muscle, the muscle of the posterior compartment of the arm. Ulnar nerve is a branch from the medial cord of brachial plexus. And the median nerve is formed by a branch from the lateral cord and a branch from the medial cord. Axilla. Axilla is a triangular or pyramidal shaped area above the skin of the armpit. It has a medial border which is fairly wide and an extremely narrow lateral border, anterior wall and a posterior wall. It has a floor above the skin of the armpit, and it has a triangular apex at the root of the neck. Medial wall of the axilla is formed by the serratus anterior muscle. The anterior wall is formed by the pectoralis major and pectoralis minor muscles, with a small contribution from the clavipectoral fascia and the subclavius muscles, which you will learn later. Posterior wall is formed by the subscapularis muscle, teres major muscle and the latissimus dorsi muscle, which you cannot see in this diagram. And the lateral border or the wall is formed by the bicipital groove of the humerus, which is a very narrow area. Lower limb. Some of the muscles taking origin from the lumbar spine and the pelvis are inserted to the upper end or the proximal end of the femur. Hence, they are responsible for movements at the hip joint. Anteriorly, you can see a muscle called iliacus muscle here, taking origin from the iliac fossa of the hip bone. And there is another large muscle which is called psoas major muscle, taking origin from the lumbar spine. These two muscles have a common tendon, and that tendon is attached to the lesser trochanter of the femur. Since these muscles have a common tendon at this level, this muscle is called iliopsoas muscle, combining the two names together. If you look at the posterior aspect, the region of the buttock here is called the gluteal region. This region is called the gluteal region. There are three gluteal muscles in that region: gluteus maximus, gluteus medius, and gluteus minimus. Gluteus maximus muscle is responsible for extension of the hip joint and external rotation or lateral rotation of the femur. Gluteus medius and minimus muscles are strong abductors of the hip joint. Compartments of the thigh. Like in the upper limb, in the lower limb also, the thigh and leg are divided into compartments by intermuscular septa. When it comes to the thigh, there are three compartments: the anterior compartment, medial or adductor compartment, the posterior compartment. The anterior compartment is also called the extensor compartment, and the posterior compartment is also called the flexor compartment. The medial compartment, as I said before, is also called the adductor compartment. There are two intermuscular septa, the lateral intermuscular septum and the medial intermuscular septum, separating the anterior compartment from the adductor and flexor compartments. There is no identified intermuscular septum between the adductor compartment and the posterior compartment. In the anterior compartment, there are several muscles. You can see some of these muscles in cross section in this diagram. This is rectus femoris. This is sartorius. Here it is called vastus medialis, vastus lateralis, and vastus intermedius. In the adductor compartment, there is an adductor longus muscle, adductor brevis muscle, adductor magnus, and gracilis muscles. In the posterior compartment, from lateral to medial, there are three muscles: biceps femoris muscle, semitendinosus, and semimembranosus muscles. In these two diagrams, you may be able to identify some of the muscles that I mentioned earlier. You can identify this long, slender muscle which is called sartorius, which belongs to the anterior compartment of the thigh. You can also identify the vastus medialis muscle, vastus lateralis, and rectus femoris muscles. If you cut and reflect the rectus femoris muscle, you will be able to see the vastus intermedius muscle underneath the rectus femoris muscle. These four muscles, the vastus medialis, lateralis, rectus femoris, and vastus intermedius muscles, taken together are called quadriceps. They have a common tendon which is called the quadriceps tendon, which is attached to the patella or the kneecap in front of the knee joint. In the second diagram, in the posterior view, you can identify the gluteus maximus muscle, which is a large muscle at the gluteal region, covering the gluteus medius and minimus muscles deep. If you want to see the gluteus medius and minimus muscles, you have to cut the gluteus maximus muscle and reflect it. Lower down here, you can identify the muscles of the posterior compartment. From lateral to medial, you can identify the biceps femoris, semitendinosus, and semimembranosus muscles. These muscles taken together are called hamstring muscles. They are inserted to the proximal end of the leg. Innervation, or the nerve supply of the compartments of the thigh. The anterior compartment or the extensor compartment is supplied by the femoral nerve. The medial or the adductor compartment is supplied by the obturator nerve. Posterior or the flexor compartment is supplied by the sciatic nerve. Compartments of the leg. Leg has three compartments: the anterior compartment, the posterior compartment, and the lateral compartment. The anterior compartment is also called extensor compartment, and the posterior compartment is also called flexor compartment. The two intermuscular septa, the anterior intermuscular septum and the posterior intermuscular septum, together with the two bones, the fibula and the tibia, and the interosseous membrane between the two bones, separates the leg into these three compartments. There is a transverse intermuscular septum within the posterior compartment, dividing the posterior compartment into a superficial compartment and a deep compartment. You can identify some of the muscles that are found in these compartments. Tibialis anterior muscle, extensor digitorum longus muscle, extensor hallucis longus muscle, and the peroneus tertius or fibularis tertius muscles belong to the anterior compartment of the leg. They dorsiflex the foot at the ankle. Then fibularis longus or peroneus longus muscle, fibularis brevis or peroneus brevis muscles belong to the lateral compartment of the leg. They contribute to plantarflex the ankle joint and evert the foot. You will learn what is eversion and inversion later. When it comes to the posterior aspect or the posterior compartment of the leg, you can identify several muscles in the posterior compartment. In the superficial part of the posterior compartment, you have the gastrocnemius muscle. It has two heads at its attachment to the femur, the medial and lateral heads. Then there is a soleus muscle. Then between the two muscles, there is a very slender, insignificant muscle which is called plantaris muscle. The three muscles form a common tendon which is called Achilles tendon. Sometimes it is called tendo-Achilles, or it can be called calcaneal tendon. This tendon is attached to the calcaneus of the foot. These muscles are responsible for plantar flexion of the foot at the ankle. Then deep to this layer, there is the deep muscle layer consisting of popliteus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus muscles. They are responsible for plantar flexion of the ankle joint and flexion of the toes. Innervation or nerve supply of the leg compartments. The nerve of the anterior compartment of the leg is the deep peroneal nerve. The nerve of the lateral compartment or the peroneal compartment of the leg is the superficial peroneal nerve. The nerve of the posterior compartment of the leg is the tibial nerve. When the person is in the anatomical position, the superior side of the foot is called the dorsum of the foot, and the inferior side of the foot is called the sole of the foot. On the dorsum of the foot, there are two short muscles which are intrinsic muscles to the foot. One is extensor hallucis brevis and the other one is extensor digitorum brevis. These muscles extend the interphalangeal joints and metacarpophalangeal joints of the toes. These muscles are also supplied by the deep peroneal nerve, which was the nerve of the anterior compartment of the leg. When it comes to the sole, the long tendons and intrinsic muscles of the sole are arranged in 4 layers. The details of these muscles will be learned later. Lumbosacral plexus. Lumbar plexus is formed by the anterior primary rami of upper 4 lumbar spinal nerves with a contribution from the 12th thoracic nerve. The femoral nerve of the anterior compartment of the thigh, is a branch coming out from the lumbar plexus. The obturator nerve, the nerve of the adductor compartment of the thigh, is also a branch from the lumbar plexus. Sacral plexus is formed by the anterior primary rami of L4 to S4 spinal nerves. Sciatic nerve, which is the main nerve of the skin and the muscles of the lower limb, is a branch coming out from the lumbosacral plexus. It is called lumbosacral plexus because there are certain lumbar spinal nerves shared between the lumbar plexus and the sacral plexus. Associated with almost all joints of the body, there are ligaments. Their function is to keep the two ends of the bones together without allowing dislocation. We will take the knee joint as an example to take an idea about the ligaments. There are 4 main ligaments at the knee joint. The lateral collateral ligament or the fibular collateral ligament, medial collateral ligament or the tibial collateral ligament, and the anterior and posterior cruciate ligaments are those 4 ligaments. There are several other ligaments associated with the knee joint which we are not going to talk about now. These ligaments will keep the two ends of the bone, the femur and the tibia, close to each other and does not allow dislocation. Sometimes these ligaments can get torn. Ligament injuries are very painful and takes a long period to heal. When you study the details about the limbs, you will have separate lectures on joints of the limbs.